Hello, good morning. This is Dr. Ahmad, and today in this video we are going to discuss about asthma station in SIMMAN. Okay, so again the approach of this station is same. The general approach of all the station in SIMMAN is the same. So first of all, while you will enter into the room, after introduction of yourself and after mentioning the GMC number, the first thing what you will do is you have to maintain the safety of patient, and for this you have to verbalize loudly, examiner assume I have taken all the universal precautions. Then you will move toward the patient, you will introduce yourself, and you will acknowledge the patient. Like you can say, hello, it's Ahmad, one of the doctor at this department. I can see you are struggling for breathing. Could you please confirm your full name and age for me? Like patient can reply, Adam 45, doctor. Then you will say, please tell me what happened to you. Or even sometime before asking, patient can say, doctor, my asthma is killing me. Doctor, save me, my asthma is killing me. So here you have to see two things. If patient is able to complete the sentence in one breath, then you will continue taking the history. If you see that patient is very struggling to tell the sentence, then you have to start the management. So let's assume that patient is able to speak. Then you will see, you will ask, when did it start? The other question would be, how did it start? What were you doing at that time? And please make sure that you ask these two questions. Do you have any chest pain? Do you have any leg pain? In any station with breathing difficulty, you have to ask these two questions of chest pain and leg pain. So after taking the history, you will have to ask MMA, that is medical condition, any medication or allergies. And please do ask about the smoker cough as well. So after taking the history, please verbalize loudly, examiner, ideally I would like to put my patient in a semi-sitting position. This is very necessary for the asthma case. Then uh, you will say to patient, like, Adam, I am going to assess you. It will include look, feel, tab and listen to different part of your body. Please be assured a chaperone is with me and we are maintaining your privacy. So after doing this, you will directly move toward the monitor. First look at the monitor and verbalize, I can see my patient is attached to monitor. Verbalize the finding, what you are seeing on the monitor, like my patient oxygen is this, blood pressure is this, pulse is this, and then start ABCDE approach. So first thing is the A, like you will verbalize, I am looking for any lip swelling, any tongue swelling or any foreign body. And then you will verbalize, as my patient oxygen saturation is low, so I am going to give 100% of oxygen via non-rebreather mask, because you have excluded smoker cough in the history. So you will give the 100% oxygen via non-rebreather mask. So after attaching the mask, you will take the mask from the drawer which will be there in the room. After attaching the mask, you will ask the patient, how are you feeling now, Adam? So after this, move toward the breathing and say, Adam, I am going to unbutton your shirt to see your chest. So I will look, feel, tap and listen to your chest. So please, first of all, look the chest, feel the chest and tap to chest. When you will listen, like when you will auscultate the chest, you will hear wheeze. Okay, on SIMMAN chest you will hear the wheeze. So once you have heard the wheeze, you will go for what? You will give salbutamol 5 mg for nebulization, and you have to change the mask as well. Previously you attached non-rebreather mask, now change the mask for the salbutamol nebulization. And at the same time you will order the chest x-ray, ECG and ABG as well in the B. So after attaching the salbutamol via oxygen driven mask, you will ask, how are you feeling now? So after asking, move toward the C. Then you will say, Adam, I am going to pinch your finger, take your pulse and blood pressure. Then you will verbalize, I can see my patient blood pressure is normal and pulse is high. In most of the cases of asthma, pulse will be on the higher side. Then you will say, I am going to insert one large bore cannula into your vein, and you will take some blood as well, and you will say like, I would like to send routine blood investigations and the infection markers. After doing this, you will again ask, how are you feeling now? And when you will ask, how are you feeling now, do see at the monitor as well to check the oxygen level. If oxygen is not improved or patients say doctor not feeling well, then what you will do, repeat the 5 mg salbutamol again. You will take salbutamol from the draw, we will put the salbutamol into the mask, oxygen driven mask. So 5 mg salbutamol you will add. This is just imaginary, there will be empty bottle of the salbutamol there in the draw. So after doing this, after putting the 5 mg salbutamol again, you will ask how are you feeling now, and then you will move toward the D. In the D you will say like I would like to check the blood sugar. If there is a glucometer there, put the glucometer on the finger, and I would like to take the temperature, and then you will say could you please move your right leg for me, could you please move your left leg for me. And after doing this, do ask how are you feeling now, and look at the monitor for oxygen. If oxygen is not improved and patients say doctor I am not feeling well, again repeat the 5 mg salbutamol, but this time with 0.5 mg ipratropium bromide. So you have to repeat salbutamol 5 mg 2 times, and third time you will repeat salbutamol along with the 0.5 mg ipratropium bromide. So after doing this, again ask how are you feeling now. So in asthma case, as exposure E, you will just verbalize the exposure, and there is no need to check for the tummy, private area, or in the legs for the asthma case. After verbalizing the exposure, you will again ask how are you feeling now, and you will again look at the monitor. If oxygen is not improved on monitor or patient say doctor I am not feeling well, then you will do what you will do, you will give the 100 mg hydrocortisone IV. Okay, so most of the time while you will repeat the salbutamol second dose, examiner will stabilize the patient, but sometime they will not stabilize the patient, like they will keep on checking you that what you are going to do next, what you are going to do next. In the last step is the 100 mg IV hydrocortisone. Here examiner will stabilize the patient. Okay, so after this patient is stable now, and now you will explain to patient and what you have done to patient. Like you will explain you presented with this and this, I was suspecting acute exacerbation of your asthma, so we have given you salbutamol, we have given you oxygen, we have repeated salbutamol, and we have given the steroid injection as well. Alright, so after doing this you will say we are going to admit you, I will involve my senior as well. But one thing, if examiner asks you like patient is not getting stable after IV hydrocortisone, what you will do? You will say that I will involve my senior for IV magnesium sulfate, IV salbutamol, and IV aminophylline. Alright, so let's suppose patient was stable with the hydrocortisone or the salbutamol. Then after involving the senior, you will do further tests like PEFR, and at the end you will advise for the triggers of the disease. What are the triggers of the disease of the asthma? You have to mention to the patient because patient is stable now. And at the end of the station, don't forget to safety net the patient for allergies, for compliance, or the for inhaler techniques. Sometimes asthma cases patient was exposed to allergens, sometimes patient was not compliant to the medications, and sometimes patient was not using the inhalers properly. So you have to address the situation accordingly. So in this way you will complete the asthma station, which is very easy. So please stay focused on ABCDE approach and continue doing this. I am hopeful that you will score maximum marks in the SIMMAN station. Thank you very much.